Let's talk a little bit about the COVID pandemic. We may be approaching what might be the first so what wave, and I'm not the person who came up with that. There's a good Atlantic article that uses that term. We had the original wave, we had Delta, we had Omicron, and we may be getting to the first so what wave where most people may just not do anything differently. We just don't know. But pandemic fatigue aside, it's starting to look like something may be happening. So a few headlines. Philadelphia is restoring indoor mask mandates as cases rise. We've gotten away from almost any mask mandates. Yes, transportation federally, although that may go away April 18th, although it may not now that the numbers are starting to rise in some places again. Medical facilities in I think most states, I don't even remember if that's federal. In most places, you go to the doctor, you're still supposed to wear a mask, at least in the Northeast. But we are starting to see some things happen again. Philadelphia will restore its indoor mask mandate. The Associated Press reporting confirmed COVID cases up more than 50% in 10 days. That's a predetermined threshold where the city says masks go back on indoors. This is being driven by the BA.2 subvariant of Omicron. The original Omicron was BA.1. BA.2 is this subvariant of Omicron. U.S. State Department orders all non-emergency government staff in Shanghai, China, to leave as COVID surges. However, the Chinese Foreign Ministry is not pleased with this. On Saturday, Chinese Foreign Ministry spokesperson Zhao Lijian said the U.S. characterization of China's COVID policy was a groundless accusation and that the Chinese side has assisted foreign diplomats and consular staff on COVID-related issues. This is in response to the U.S. State Department warning about the arbitrary enforcement of local laws. Universities reinstating mask mandates amid COVID surge. The American University announced Monday it's putting a mask mandate back on in D.C. Columbia, Georgetown, Johns Hopkins, Rice universities are also doing this. The reason? The highly transmissible BA.2 subvariant, an average of more than 31,000 new COVID cases across the country. COVID could be surging in the U.S. and we might not even know about it. This is also an important issue, and I know a lot of people are sick of hearing about this. We know that there is less testing going on. We also know that a lot of the home testing is not being reported to authorities. So a lot of people, this started to be an issue during the first Omicron wave in December. It's an even bigger issue now where increasingly a lot of people are testing at home, testing positive, and then they throw the test out and they go, I'm positive, and that's it. That doesn't show up in the numbers anywhere. Not to, I have no reason to think Sam Cedar is doing this, but we sadly learned yesterday that our friend Sam Cedar from the Majority Report has tested positive. He's had a bunch of different negative tests, didn't feel well. Now he's positive. I don't know what type of a test that was, but the point I'm making is, without accusing Sam of anything, if Sam's eventual positive test was a home test, that's not automatically counted anywhere unless Sam reports it. And because of the decrease not only in people seeking tests, but also the decrease in some of these municipal and federal testing sites, we just know we're almost certainly not capturing all of the cases that are going on. So what's going to happen? I don't know. I am convinced that the threshold for people going back into a cautious state is much higher, much higher than it was before. And what I mean by that is, a slight increase in cases and deaths at this point for social reasons is not going to kind of drive us back in terms of our precautions. I think people are much more comfortable accepting a certain level of risk. I'm not immune to that. I went to Las Vegas last week. There was not a mask in sight. I was around thousands of people, and thankfully I didn't get sick. And when I got back, I didn't see people for 4 days until I really knew I was in the clear. But would I have done that at a previous time? Probably not. At the same time, the numbers look a lot better. So we're going to have to see what happens. I think you will absolutely see a much more stark difference between states as, in all likelihood, cases continue to rise and eventually hospitalizations do. as well. Let me know your perspective on this. Let me know what you're doing. Let me know what you're seeing in your state. You can find me on Twitter at @dpacman. And 1 week from today at 6 p.m. Eastern, we'll have the next David Pakman Show Town Hall. I hope you'll join. Everybody gets to ask questions. And it will be streaming live on the Pakman Live YouTube channel. One of our sponsors is Blinkist, who's been supporting the David Pakman Show longer than any other sponsor. Blinkist is the app that lets you listen to or read an entire nonfiction book in just 15 minutes. Blinkist is the way to absorb those books you can't make time for. Blinkist takes top nonfiction titles, pulls out the book's key takeaways and insights, and gives it to you in the form of a text or audio explainer that you can consume in 15 minutes. With Blinkist, now you actually do have time to learn about all the things you've been wanting to tackle. On the Blinkist app, I just listened to This Is Your Mind on Plants by the great Michael Pollan. Super interesting, the history of caffeine and so many other things. Blinkist has you covered on podcasts too. Blinkist takes long episodes of popular podcasts and distills them into audio you can listen to in 15 minutes. With Blinkist, you can become knowledgeable about so many different things. You can have conversations with people about more topics. Blinkist makes you more well-rounded. Try Blinkist for free and get 25% off a subscription. Go to Blinkist.com/Pakman. The link is down below.